Hey everybody, what you're about to see took place in the parking lot for Kaiser, behind the Orway building and in front of the other Kaiser Headquarters building. It is a demonstration, really what the participants call a simulation of what would happen if Kaiser laid off all of its frontline healthcare workers, as it plans to lay off a number of key frontline healthcare workers starting Friday. And some of the workers whose jobs are to be cut were laying in these 24 gurneys and to simulate patients that one patient care technician helps to feed. And it's the patient care technicians that are slated to be laid off. So here is the video of that protest that occurred yesterday, on Wednesday.
This patient who has been at her bedside for an hour and 15 minutes. This patient is a diabetic. Now this patient is unresponsive because her blood sugar went so low to wait for me to come and feed her, and I still can't get to her because I'm still down here feeding that patient, which causes another delay in care, a drop in blood sugar, malnutrition, and anger. This patient needs to get up and go to the bedside commode. I gotta find a walker. He's got a basic bedside commode, but there's no walker. So I would have to go next door, borrow her walker, which she's not gonna be happy with because she wants to go for a walk with her own walker. When I borrow her walker, I bring it out, I have to sanitize it really quickly, and then I can take him to the bathroom. But when I come back to bring her walker back and it's all clean and sanitized, she cussed me out for taking her walker and then didn't take her on the walk, because now I still got to tell her, I'll be right back. This patient came last night. She wants to freshen up. Unfortunately, I gave her all the supplies, but she has a dislocated shoulder and can't do it, and she's right-handed. So it would need to be the PCT that would come and help her wash up. Unfortunately, I don't have time because I have not one person I'm feeding. I have another person that's waiting to be fed. So she would still have to wait to be washed up. If I had a partner working with me, more staff on the floor, I can handle these tasks without any problems. But as I work 1 to 24, I cannot handle these tasks. I can work 1 to 12, I cannot handle the task. This patient right here is my third fleet feeder on the floor. She's very
Hey everyone, it's Elise out here at Kaiser Headquarters. Kaiser's laying off our patient care technicians. There's 1 or 2 per floor, and they help people get up, they help people go to the bathroom, they help blood pressure readings, they help give food, they help clean up the patients. And after COVID, Kaiser decided they wanted to lay off 200 people that do direct care.
911 called the station and said she's calling. But these are the things that happen when a PCT is 1 to 12, 5 to 24. This patient right here has been waiting for an hour and a half to be repositioned. Now it took 15 minutes to find 2 more people to assist me with the Hoyer Nyckel lift just to get her properly repositioned. This PCT has been sitting in the room at the bedside for 6 hours. I've only been able to get her a 5-second back.
We need PCTs. The nurses need PCTs, and patients in the hospital require them to get attention because the nurses are 3 to 1, and the patient care technicians do most of the toileting, feeding, repositioning, walking.
This is what it's like to work as a PCT in Kaiser, Oakland, whether you're on the night shift, the day shift, or the PM shift. These are real struggles. I have educated.
I don't see Libby Schaff.
All the PCTs already knew because they have walked in this mile of shoes.
But Sheng Tao is here, and Dan called.
They're going to be 100% for the patient. They're doing 12 hours. They're doing 16. They're coming in on their days off. They worked hard for the pandemic, and now
No! We say no way.
Hey, please share this video because the organizers of the event, I believe, were looking for the traditional news to stop by, but given that is a major television advertiser that feeds money to those same news and television organizations, you're not going to see that. And then when they do come by, the reach of the news that they produce isn't that great. So this is the 21st century. We can do better. Help the line workers out by sharing this video and asking Kaiser to not lay off their patient care technicians and other frontline healthcare workers. Subscribe to Zenny62 and bookmark oaklandnewsnow.com.